My approach to patient care is first to listen. I think that's a really core piece of child psychiatry. So when a family seeks care from me, my job first is to really try to understand what brought you here. And often what we know is that parents have a good idea of what's going wrong. They know what is typical for their child and they know what has changed. And so my job is really to listen and ask good questions. I'm Shayla Sullivant. I'm a child and adolescent psychiatrist at Children's Mercy, Kansas City. I work on lots of different problems that present in childhood. Suicide prevention is a big focus of my work, but I see kids that have ADHD, anxiety, depression, eating disorders. The list really kind of goes on and on. So I would say I got early exposure to psychiatry growing up. So my mom is a psychiatric nurse. My father was in social work. So the dinner table conversations at our home were probably a little different than at most households. But I worked in Arizona for a year with adolescents at a treatment facility. And I got to see firsthand when young people have been living on the streets and they've endured a lot of trauma, what can improve in their lives if they have stability and they're working with a good child psychiatrist. And then I worked in New York and I did research with people that had severe depression. And I think that really solidified my choice because I saw folks that were so ill that they couldn't even function. I remember one patient was so sick she couldn't get out of bed to talk to me. And then my role was to follow them. And so I went to her home for the follow-up and she came to the door with this giant smile on her face and she had baked a pie for my visit. And I just remember thinking, this is amazing. This is almost like a miracle. I want to be part of this work. And so I came home and went to medical school. So I think one thing that's really important that we do at Children's Mercy is that we bring an entire team to the care of the patient. And often parents aren't aware of that I am backed by an entire hospital of specialists. And sometimes when I make a recommendation, I send a family to family therapy, for example. That may be the change that completely impacts the outcome for that family. So I think it's really hard for me to imagine practicing in any other environment where I didn't have this team approach.